Welcome back. Now, while South Africans seem to be divided on whether or not the national state of disaster should be lifted, some medical experts have intensified calls for government to end the national state of disaster. Several civic society organizations, political parties and health experts are weighing in on this matter, saying that it is now becoming a hindrance to people's lives and that the mutation of the coronavirus has forced people to adapt and live with it. Meanwhile, the National Institute for Communicable Diseases says that 4,514 new coronavirus infections have been identified in the latest 24-hour reporting cycle, with the increase representing a 10.6% positivity rate. So to discuss all of this, we're joined by medical expert and CEO of Higher Health, Professor Ramneek Ahluwalia. Professor, good to speak to you again. Welcome to Morning Live.
An absolute morning. Absolute honor. Good morning, everyone. Thank you.
Professor, just taking a look at what is being said at the moment, and we look at, of course, the stats, which we get every day, 4,500 new infections in the latest reporting period, and looking at just under 67,000 now active cases of COVID-19 in South Africa. And at this point, the calls are growing louder and louder to do away with the national state of disaster. Are these calls justified?
You know, Sakani, we find ourselves in a very interesting time with the COVID pandemic. Now, why I say this is predominantly because the world has seen hope. Maybe the global world has seen and realized that finally we saw a variant which mutated to a level where we saw so many mutations. It kind of also developed something we were worried when we called it as escape mutations. But in no doubts, this new variant showed reduced pathogenicity or reduced infectivity or reduced severity. And I'd like to remind all our viewers that when we started in March in 2020, when the original coronavirus came, we saw a peak, we saw many deaths happening, many hospitalizations. Came a period in December, we saw a beta variant that was detected first in South Africa, and that variant was absolutely lethal. The waves doubled itself from the original coronavirus. What it was showing was that the virus is showing affinity to bind to our human cells better. It's replicating faster. The viral load is increasing faster. The person is spreading the virus faster, which means the virus starts infecting many more people beyond the first original coronavirus. And then eventually we also realized that the mutations are more pathogenic, means they were causing more deaths and more infections. When we came in May, we saw another wave, another variant called Delta in South Africa, which was first detected in India and caused another havoc. It was a 3 to 4 months wave. It climbed peaks which we had never seen in terms of infectivity, which means the virus started binding to a human cell more better. It started multiplying faster. Infections were faster. But again, we saw pathogenicity or the infectivity of the virus more stronger, which means it became more lethal. And then comes now Omicron, giving a hope to the global world and saying, okay, enough is enough. And this is a possibility that this virus is now taming down where it has become milder. Doesn't mean it's not causing loss of deaths. It doesn't mean it's still not spreading fast. It's still binding to human cell better. It's finding escape mutations. But there is definitely no doubt there are 3 factors that are working. One is a person's own immune system, which is 70% of South Africans having had the virus during the first, second, third wave. It's holding its guard. The second is the vaccine immunity. And unfortunately, South Africa is not to be compared to the first world. And I want to remind everyone, we're still a developing world. Africa's only got 10% of the fully populated, vaccinated population. We are still sitting at around 40%. And approximately in that number, which is not healthy science when we talk about vaccine immunity, which seems to be stronger than the vaccine and the natural immunity. And the third one is that the virus is losing its mildness. But I would not go with the fact that we should remove the state of disaster. I would say we should revisit the state of disaster. We have seen this virus is taming down. It's a legislation that takes so long bureaucratically to put in place. This virus is like a family tree. So we still have the original coronavirus in the system. We still have the alpha, we still have the beta, we still have the delta. And their offsprings are still mutating in some of the other human body where it's around the world, whether it's in Africa, whether it's in Asia, whether it's in Europe. Because somewhere the human body, the virus is still mutating. And what we've clearly seen, it's a mutating virus. What we've seen is an offspring called Omicron, which is very milder, and the world and from the previous pandemics, we've seen it can and will become more milder. But one thing cannot be ruled out is, will the offspring of a beta food chain or the offspring of the Delta, which is still mutating, can it still become more pathogenic? At this moment, a world has seen the first hope. We need to see what the new mutants will come and give us an idea of the future waves will look like. And I think that's the time we should start contemplating towards how we deal with COVID. But what I agree with is that the national state of disaster needs a total revisit. It's old. The science that was put was 2 years back. There are lots of other relaxations that can still be done to accommodate our economy. Our economy must run, but we should still guard. We should be cautious of another mutant that can keep us for a surprise. And there we should not be found ourselves putting legislations and lose lives while we can make quick decisions.
So what sort of revisions do you believe should be done? Because we also see, Professor, a growing number of medical experts who seem to think that the state of disaster is not really effective as it is. So what should we as society be doing? How should we be treating this virus at this point in time?
See, I think clearly we are moving out of the fourth wave. We've just released some data that we still have 10.6% positivity rate in South Africa, which means out of people testing, 10% of the people are still positive. And many people, many viewers who are listening to me will know they have seen one or the other family member or a friend who either passed away or was severely hospitalized due to COVID in one of these waves. So we need to relax. We need to open our schools, which I fully agree with it. We cannot let an education system down and building the skills economy, considering that we have now seen a variant which has been milder, less pathogenic, and we are growing our vaccine immunity gradually. So there is this sphere. But what we also preach is we cannot not remove masks in congregate settings. When people are coming together, when people are indoors, when there is less of ventilation, people are in close contact, masks will protect. We have seen it. And right formulation of putting the mask together, that's there. Yes, there's no need for thermostat. There's no need for temperature checking. It is of no use. Daily health screening yourself, people know the symptoms. We have to reduce the isolation days from 10 to 5 working days. And starting from the first day, you start showing symptoms. I fully agree there's no need to test. If you are mildly symptomatic, you stay home, recover, and when you are more sick or you're feeling you're not coping with your sickness, seek a doctor, let the health practitioner help you and decide you whether you should go for a test or get admitted in the hospital or recover from home, considering now we know the science of how to recover from this pandemic. We need to ensure that vaccinated people be more encouraged to be brought into congregate settings, but we should not leave anyone behind from when it comes to education, whether it comes to higher education, but making sure that a balance between an online and a contact learning starts now happening so that more contact learning, because skills can happen. Workspaces must come in full force back. Outdoor gatherings must happen in full outdoors. Masks in outdoor gatherings can only be needed if it's a crowd together. But if you are far distant, the virus will not be able to spread because you are maintaining that distance. But when you are indoor, masks will play a very important role. Sanitizers do have a big role in not only for COVID, but for many other viruses and bacteria. And this is a good practice that we initiated. So I think changes are needed in the national state of disaster. Not taking it out, cautious approach is needed. And I fully agree with the World Health Organization executive director that has said, when Africa is just 10% fully vaccinated, when human body, and we cannot benchmark ourselves to the first world countries. We are a third world country. We have a huge population which is not yet vaccinated. We still have to push a lot of vaccine promotion because we've seen that the vaccine immunity does reach to the 3 lines of defense. At least we have seen it with Omicron. And we are hoping that the future variants will continue in the same spree as the Omicron, which means our immune system will be able to overcome. But the word will always be is let's open the economy, let's live. But in case our science discovers a mutant or a variant that is of high concern, these legislations can help us save more lives by putting, at least for that period, restrictions, because bureaucratically to put a legislation back is absolutely challenging.
Prof, how do you respond to people who say that we in South Africa, although people are not really queuing up to take the vaccine, if you compare our fatality rate, as an example, to some first world countries where the populations are by and large, fully vaccinated, we seem to be faring better all round. And there is still quite a lot of vaccine hesitancy, vaccine skepticism in the country, and people simply refusing. We know that we have vaccines in South Africa, but people are just refusing to take it. How do you respond to that?
So, there's a debate in the world, something called your own natural immunity, and then there is something called the vaccine immunity. Now, the natural immunity is existing irrespective you have a vaccine or not. The question is, how strong is your natural immunity to fight an infection? Yes, when this virus came new, there was no natural immunity because our body was never exposed ever to a virus similar to that kind, because it was novel, it was new to the human mankind. And then when people started getting infected and people who could, and to be very honest, the virus started increasing its pathogenicity gradually. The original coronavirus was not as pathogenic as the beta or the delta, or not as fast spreading as the others were, which means more and more South Africans, more and more global world started getting infected. What happened was the body started realizing this antigen when it started entering the body, and it produced something we call the first line of defense, the second line of defense, the third line of defense. Well, it's too early still for scientists to confirm that how the natural immunity acts on the three line of defense, which is the beta cells or the T cells or the memory T cells, the killer T cells. And these are type of, in a simple layman language, defense mechanism that goes and attack the antigen and kill the antigen, which is a virus in this case, and destroy the virus. And sometimes we have to destroy the cell and the virus, which is it binding, so that we can wipe it out from our body. But what happens is the virus also starts multiplying in a fast number, increasing the viral load. On the other side, our cells are also multiplying in a fast number to fight it. And sometimes that viral load increases more than our immune system. And because of our comorbidities, which does not allow the system to grow in that level, we succumb to it and we end up in the hospital ICU. And that's the reality where we are. What we've clearly seen is, for those South Africans and those Africans who have not been vaccinated, are relying on natural immunity. You are not sure whether you have been, if you did not realize that you were asymptomatic, you do not end up realizing that you had the virus or you have natural immunity. But with a vaccine, you're dead sure that you have produced some immunity in your body. And that immunity historically has been more stronger than the natural immunity, because the antigen that we will inoculate in you, which is a dead virus or a messenger RNA, which is through a vaccine, will touch those three lines of defense to build it in time and gradually. No doubt, even the natural immunity falls, the vaccine immunity falls with time. And that's why the booster is needed. And in natural immunity, you do not have a booster, because the only booster for you is to reacquire an infection, which is not good. Because anytime you get an infection, your body still goes down. There's still a fight in your immune system and the virus, which is still not healthy. You lose a lot of cells deaths, you lose a lot of own body, you get fever, you get tired. But more importantly, you can even get your lungs to pneumonic phases and admission to the hospital. And there is being deaths even in Omicron. So the vaccine immunity is very advisable. My appeal is boost up your immune system. Even if you have a natural immunity, the vaccine immunity will only boost it up to a level that it will not allow that virus, because the virus will come. Virus doesn't know that you have immunity or not. The virus will move. The virus will enter. A new variant will still enter. But it's your system that will fight it to not allow it dominate over you. And that's what we want. And the last part is, as you overcome the viral load, quickly through your immune system, you will spread less, which means you will also cause harm to others. So I think it's a very important methodology that let vaccines be there and let people do take vaccines because you are 100% sure that at least you have an immune system that will fight for you.
And we are out of time, but just very briefly, if you will, Professor Ahluwalia, we see the Omicron variant, of course, still dominant for us. That's what we're dealing with. But you spoke about the mutations earlier on, BA.2 being detected in India, Denmark, and Britain. What do we know about this? And is this likely to have any sort of bearing on the decisions that government will take about the state of disaster?
So what government will be seeing is this is a mutating virus. What you talked about now will be another mutant that will be discovered in another part of the world. Not all mutations are of concerns. Some are only for interest because we're just watching their offsprings. Are they mutating to what level they are mutating? Can they escape our immune systems? How far they will escape? How they will bind to our human cells and they will go unrecognizable from our immune system so that it will allow them a freedom of viral replications and a huge viral load that will overcome our immune system. And that's what the science is watching. Omicron gave us a hope that no, this is losing its pathogenicity or infectivity and we can overcome. But nobody can guarantee. So that's why it's like an offsprings of children. You know, a father and a mother, parents produce some children. They are all in the system and they are also still producing, they are still mutating into new offsprings. It's like a family tree. Do not know what the beta kind of a variation will produce another offspring, and will that be able to overcome our immune system to the level that we have not seen before, or our immune system will still stand intact and defeat the virus. So that's something which is still unknown. And that pushes the government to keep on thinking, and it's better to keep a natural state of disaster, revisit the old school, which has been since 2020, change a lot of things to allow economy to run in full relaxation. But should there be an element, exactly what you said, we found something in India and Denmark. We also know that we found something in France. We also know there's a new variant of concern being found in Brazil. Scientists are studying how deep of concern it is, what kind of mutations it is. And that keeps you on your toes to say, let's take a cautious approach. Let's not completely wipe out things, but do open our systems. And when we have good days, let's finish everything. And we pray the good days continue forever. And this virus tames down, as we've seen with Omicron. But a guarantee cannot be given at this stage, and we need to guard ourselves still.
Professor, what a note to leave it on. Thank you so much for your time. As always, a pleasure speaking to you. Medical expert and CEO of Higher Health, Professor Ramneek Ahluwalia.